Hello and welcome to Ask Dr. Gupta. We have been discussing about cancer these days. So we shall continue with this, and today we shall discuss which treatment should be the best for a particular patient. As we all know, cancer is a potentially life-threatening illness. Once in the body, we should try to get rid of it as fast as possible, as effectively as possible. This riddance can be in the form of physical removal by surgery or by burning it in situ with radiation or destroying it with drugs called chemotherapy. Sometimes there is overlap between these modalities and the patients tend to get confused about which treatment modality will be the best for them. If they are told operation, people feel that this will be mutilating. There are similar fears about radiotherapy and chemotherapy also. Today we shall try to discuss all these modalities one by one and shall try to find out which should be the best. The first is surgery. Surgery or operation is the most dreaded treatment modality. Interestingly, this is the only treatment modality that cures within a week. There is a perception, a popular perception, which is true to some extent, that surgery means amputating the part of the body that is affected by the disease. And the surgeon's image is of a butcher who has a knife in his hand and he will chop off everything that comes his way. I will say that please be kind to us. What perception is just being discussed is actually oversimplification. Today, with modern techniques, the affected organ is preserved in most of the cases unless the patient comes to us in very advanced disease. The period of recovery after operation is much more comfortable these days than what it used to be 2 or 3 decades back. Remember, operation is done not to make anybody handicapped, but to get riddance from disease. Surgery is preferred in young because its long-term side effects are minimal. Similarly, surgery is preferred in the very aged also because this is the least complicated and the best tolerated treatment modality. So surgery is actually much better than you thought. Next we come to radiotherapy. Radiotherapy is not as simple as it is generally believed to be. Radiation is given with or without chemotherapy in early stages of some cancers like soundbox cancer. It is more often given in conjunction with surgery, mostly after this. Sometimes when there is cancer in bones, then to relieve the pain, to control the cancer in bones, to prevent fractures, the bones are given radiotherapy. There are temporary problems of radiotherapy like skin reactions and sometimes long-term problems like dryness of mouth. Modern technologies, radiation techniques have reduced these problems and have brought them to the minimum. Radiation is given with the patient lying on this table and the machine that you can see, the gantry, rotates around the patient is stabilized and then radiation is given. So please do not depopularize radiation as a treatment modality. It does have its problems, but overall the benefits far outweigh the problems. Next we come to chemotherapy. Chemotherapy is the most infamous mode of cancer treatment. Interestingly, most of the patients, they end up getting chemotherapy during one or other phase of their treatment. There are misconceptions and rumors that abound about chemotherapy. The most prevalent rumor and the most untrue is that chemotherapy has snake venom in this. This is actually laughable. We must understand that the chemotherapy drugs come from diverse sources and are mostly synthetic. I had a lady who was quite aged when she was being taken to her hospital room for chemotherapy. Then she was very much scared. I asked her that why are you that scared? When asked 3-4 times, she told me the reason. The reason made me smile and also made me sad. Some relative had told her that during chemotherapy, she will be given electric shocks with 2 electric wires. So she was looking very fearfully at the electricity switchboard of the room. When the chemotherapy was over, then she asked me, is it over? I said, yes, it was only this much. She was very happy, she was relieved, as she was smiling at the stupidity of that rumor monger, of that well-wisher. So let me re-emphasize this for those who believe these rumors, that chemotherapy comprises of medicines which are given slowly over a pre-decided schedule. The most infamous complication of chemotherapy is hair loss, alopecia. We as doctors are not that much worried about this because number one, this is temporary. The hair come back when the chemotherapy is stopped. On the other hand, the disease that is being treated is life-threatening. Number two, we are not much bothered because it is easily manageable by wigs which are widely available in market, and these wigs are needed only for the duration till the natural hair come back. Next comes targeted therapy. Targeted therapy is very famous in rumor markets. It is believed to be a magic wand that will cure any cancer that has not responded to surgery, chemotherapy, radiation. The reality will disappoint those people who believe this kind of rumors. Targeted therapies are actually group of medicines that act on specified receptors in eligible patients who carry that receptor in their tumors. It is given with chemotherapy or after chemotherapy depending on the suitability and the situation. More often than not, it is used in advanced diseases when other treatment modalities have failed. Now the main question, what is the best? I have seen patients refusing chemotherapy even after detailed counseling. The doctor will advise any treatment to any patient only when the doctor feels that the benefits outweigh the risks. So please do undergo the treatment that is being advised. I have seen a lady in her 70s who had advanced cancer of gallbladder. She was a very frail lady. She was given chemotherapy. She was with us for about 7 months or a little more, and she was walking around comfortable. This is when we were treating the cancer which is among the deadliest. She was aged, she was frail, so we had dose restrictions. Even then we could get that precious time, that valuable time. On the other hand, the patients dying within 2-3 months or maybe even less with a lot of sufferings who refuse chemotherapy is not very uncommon. I recently saw a middle-aged man who had deep invasive cancer of his urinary bladder. He was advised surgery, removal of urinary bladder by surgeon. The patient was adamant on not getting operated. So he went to a radiation oncologist and said that radiate me. The radiotherapist refused to radiate him and said that in this situation, this stage, surgery is the best treatment for you. The person didn't budge and he went to another radiotherapist till he found a person with flexible ethics. Finally, he got chemotherapy and radiotherapy. Today, the person cannot hold urine. He moves around wearing a diaper, needs surgery to remove his bladder, and a bag will have to put on his skin for drainage of urine. Removal of rectum or removal of sound box, if told to somebody, is many times flatly refused. Patients say we prefer to die than undergoing this kind of treatment. So let me make it clear that I would prefer to die is again an oversimplification. It is not that simple. These patients sometimes go on alternative treatment because sometimes they are promised cure within 6 months, within 2 months by alternative therapists. Mostly these patients come back in emergency after 2-3 months in very bad shape. At that time their families are begging for treatment. Unfortunately, at that time the disease is quite advanced, and because of this time gap the patients are also depleted. We are in a position to only offer symptomatic and supportive treatment like painkillers and anti-vomiting drugs. Nothing more than that can be done. So we can draw a conclusion that let the specialist decide what is the best treatment in a particular case. Do take second opinions, it is very good, but do not force your misconceptions or superstitions on the patient. This can be life-threatening, this can prove very costly. 3 treatment modalities should not be used and should not be seen as competitors, but they are to be used in optimal sequencing to get the best outcome. Please trust your doctor. He will offer you the best, he will do the best for you. With all this, I wish you all a very healthy life, and those who are undergoing treatment, I wish them a very happy and very fast recovery. Thank you.